The point is that was it normal delivery? Normal delivery. Now, if you look at ultrasound, whenever you give your ultrasound, the first thing a woman look at is on why, now which date. But there are much to that. If you look at the ultrasound, much earlier in the ultrasound, when the baby is less than 5 months, if there is an ultrasound done that time, if you look at that scan, they will go to placenta. Sometimes they will tell you grade 1 maturity, grade 2 maturity, grade 3 maturity. I don't know if you understand. There are people whose placenta mature faster than the baby. So if you do scan when the baby is 5 months and you are getting grade 3 maturity, even at the ultrasound is telling you that the placenta has been older than the baby. So by the time the baby will now be 37 weeks, the placenta has been more than grade 3 or grade 4. So grade is telling about the blood supply. So those people that their placenta matures much earlier, as I said earlier, we have a reduction in blood supply. And once there is a reduction in blood supply, the baby will go into distress and the chances of pooing in the womb increases. What you are advised to do is that you will do nothing. I don't know if you understand. It's a natural thing. And one of the things we have been doing is that if you look at all the baby, none of them reach for 40 weeks. I don't know if it's a natural thing. What you like a media, it's just to make sure that you register in the hospital. This baby is kept on being observed. There's no other thing you do about it. It's only, but much later in life, we might now start saying, let us watch this person's blood pressure. Because if there's an increase in blood pressure, that is one of the things that makes the placenta to age earlier than normal. I don't know if you understand. Now, if you're a woman who is less than 5 months pregnant, if you check the blood pressure of that woman, it is usually lower than normal. It's normal. Their blood pressure is lower than normal. But if that person now book in antenatal at 5 months or 4 months and you check the blood pressure, you will have 120/80, which is what? Normal. But mind you that 120/80 is a reduced BP. It means that before conception, her blood pressure might be 140/90 or so, which is hypertensive. So if she carries that borderline hypertension for a very long time, the baby will be small for age. Then the placenta will mature faster than normal. In as long as we have diabetes, we say that people who are diabetic, their baby are usually bigger than normal. People that are hypertensive, their baby are usually smaller than normal. But if there is a baby that is consistently smaller for age, then there is a placenta that matures earlier than normal, then the chances that that person might have hypertension is there. But because that person might not even come to clinic except when she is pregnant, and by the time you measure the BP at that time, the BP appears deceptively normal. But the only thing we can do is to monitor the blood pressure. Once it's normal, then any other thing can be taken care of. There is no drug you will take unless there is already established thrombosis or so. We can say, let us give vasoprene. But vasoprene is not a common thing you take all the time. But recently, it can be taken in pregnancy.